Good afternoon for some of you. Thank you, Dr. Keller, for the introduction. It is a pleasure to be with you today. I was fortunate, or maybe unfortunate, by being invited by Dr. Ritchie to present about fowl cholera prevention and control. Fowl cholera is an old disease, and maybe it's because I'm one of the older guys in the industry now that he's invited me to present about fowl cholera. I'll share some topics with you today. What I would hope to really present to you today is a review of fowl cholera, the disease. We'll start with a little bit of historic facts, just amusing historic facts, interesting facts. The disease itself, diagnosis, the immune response, and then the prevention and control, which is the key point really. How do we prevent fowl cholera? How do we control fowl cholera for you in the farms, in their operations? And then a few key studies, and I'll end with a few summary statements. Now, fowl cholera, as you can see, is an old disease. Louis Pasteur worked on this in the late 1800s. Hence, the bacteria is named after him. But it has been a problem in poultry for all those times, 150 plus years. He worked on a bacterin, an inactivated bacterin to help prevent or control the disease. While it was not very successful in controlling the whole disease, it was a start of control and the work on controlling fowl cholera. The disease itself was described in the US as early 1867. And it was actually important for the US industry because it was one of the diseases that was a reason for the creation of the veterinary division of the USDA. So from a historical standpoint for the US poultry industry, fowl cholera is one of those important diseases. It is significant also in wild waterfowl. There have been reports of Canadian outbreaks in waterfowl as early as in the 60s was when it was reported in Eastern Canada, and also snow geese in Western Canada in the 70s. So it is a disease of both poultry and wild avian species. And the crossover is something that, especially if I remember correctly, in BC, you'll have that crossover of the wild waterfowl and the poultry industry right in basic geographic regions. So again, the importance of other species will be important in the control of fowl cholera. The disease itself has been called many names: avian pasteurellosis, avian hemorrhagic septicemia. And as you can see, it depends on how the disease presents itself. It is could be an acute disease. It could be very high morbidity, high mortality disease. Or it could be a chronic disease, usually after an acute infection or the use of actually live vaccines sometimes lead to some chronic fowl cholera in the flocks. Interesting point, turkeys and waterfowl are actually more susceptible than chickens. So you'll see that turkeys and waterfowl, you'll see outbreaks and more significant clinical disease in this species. Another point with fowl cholera is older birds seem to be more susceptible than younger birds. In fact, when we do some trial studies, we have to wait the birds to be around 10 to 12 weeks before they can be infected fully by some of these Pastorellas. So younger birds tend to be more resistant. Older birds tend to have the disease and have the clinical disease. It is still a major economic importance in the poultry world. It's still worldwide. It's not just in commercial poultry, but small poultry, backyard poultry, and as I mentioned, in wild birds. Historically, it's only been observed in broiler breeders. And that's because the poultry industry through the years have moved away from breeding birds in the floors. The layer type birds move to the cages, thereby reducing the exposure to the Pastorellas. But now that there's an increase in cage-free rearing, the increase in free-range birds, free-range layers and organic broiler operations, we have actually seen an increase of cases of fowl cholera in these birds, even in broiler birds, again, being out in the field and being exposed more to the pathogen. So it has increased in the recent past. It has increased. We've been seeing it more, even in cage layer facilities. We have seen reports of Pastorella. Now, as I mentioned, it goes as either acute or chronic, and then an acute systemic disease, septicemic disease, really. And normally or often, what you'll see is just an increased mortality. You don't see any clinical signs, or you don't see any other signs except an increased mortality. It could be as high as 20 or plus% sudden mortality in the birds. And then you start seeing some birds with fever, ruffled feathers, real depression, anorexia, general malaise in the birds. In some, you'll see egg production drops in the layer birds. And what you'll see in some of the birds are mucus. So it's more of a respiratory type infection at first. You'll see mucoid exudates from the mouth or from the nose or conjunctival areas. And then you'll see the dead birds basically cyanotic, red. So it's a very acute septicemic disease, as I mentioned. But then, and I'll show you some lesions here, and I appreciate the AAAP for allowing me to share some of these slides. You'll see some birds that are depressed. Here's a turkey, fairly depressed, ruffled feathers. But as I mentioned, mainly you'll see mortality. And what you'll see in these acute cases is either just necrotic areas in the livers. You see general hyperemia or red in most tissues. The ovaries, as you can see, are hyperemic. And then sometimes you'll see this lung lesions that can, as you can see here, this is one lung, one less than the other one as far as the lesions. But you can see these, especially in turkeys, you'll quickly see this necrotic lung lesions. And you'll basically see necrotic tissues in the lungs and in the liver. And that's basically what you notice a lot of times with these acute lesions. It's a very quick coagulative necrosis of the tissues, mainly the liver, the lung, and then basic septicemia. And the septicemia is mainly caused by the endotoxin that's produced by the Pastorella. The other form of the disease that you'll see is a chronic infection. There may be a low level increase in mortality. Sometimes the mortality is generally okay or within standard, but you might see a little increase in mortality. But mainly it's because of lameness. You'll see chronic lameness, whether it's the hock or the foot pad are infected. Sometimes you'll see swollen wing joints or swollen sternal bursa just from the infection and from birds just being on the ground most of the time. You'll see some birds with torticollis, mainly due to infection in the middle ear or in the brain. But sometimes you'll also see some respiratory rales or dyspnea, birds unable to breathe. And here again are some images of the chronic lesions. You'll notice wattles. Wattles and combs tend to be infected chronically with fowl cholera. And these are the places where you can actually go and isolate some of the bacteria from. The more chronic cases, as you will see, some pericarditis, perihepatitis, just coagulation and infection in the organs. And as I mentioned, just hock infections, some suppurative or caseous hock infections, causing the lameness, causing the, and then the ovaries become regressed. And as you can see here, this one bird with torticollis, usually that's because of infection within the middle ear or in the brain itself, causing some of that in the meninges itself that causes the bird to kind of have that torticollis. But really it's a chronic suppurative infection in various tissues. And these are usually what you'll see in breeder birds or long-lived birds that have had the infection for a while. Now, transmission of this disease, the introduction is usually a wonder sometimes. We may not necessarily pinpoint exactly where the Pastorella enters the flock, but introduction into the facility could be from other animals. And likely, a lot of times it is from other animals, whether it's other birds, other wild birds, or often it's the rats, the vermins, the cat, other animals within the farm. Pastoral multocida, or in some cases multocida, as they say, is found normally in the oral cavity on the mouth of other animals. And they're not infected or they're not clinically sick with it, but those isolates can be transferred to the birds. So the rats, the cats often are sources of introduction into your facility. So remember that as we discuss preventive measures, because those types of animals and preventive measures will correlate. Contaminated equipment have been documented to cause some entry into the farm, whether it's flats or other types of equipment, even clothing sometimes have been blamed for introduction into a facility. The other, and probably more often, introduction of especially the chronic type of fowl cholera. The other one is vaccine induced, really the live vaccines. While we have live vaccines, while they're attenuated or avirulent, they do still cause some clinical disease. And sometimes that they turn into a more chronic case, or whether the vaccine itself is too strong. For example, there are different vaccines available out there of different attenuation. The PM1, which is the medium vaccine, is still fairly strong against turkeys. So most of the time, it's the milder M9 vaccine strain is the one that's recommended for turkeys. There have been cases where higher titers of the vaccine itself have caused some of these chronic infections or a reversion to virulence in some cases. But again, titers, the strength of the vaccine can be a factor in some of these chronic infections. Or poor administration, just poor administration. Birds are not properly vaccinated, whether it's the wing web, those types of, or when you give it in the water, poor administration just causes the vaccine virus, or the vaccine bacteria, I'm sorry, the vaccine bacteria to really just take different and get rolling within the flock. The other thing that again is important is the sick and the dead birds. The presence of sick and dead birds actually continue to transmit and disseminate the disease within the flock. So we often say, pick up your dead quickly, get rid or cull your sick birds quickly. That way they don't contaminate the feeders and the drinkers. Again, some of these birds have the bacteria in their nasal exudates and their oral exudates. So drinking troughs become contaminated quickly with Pasteurella. And sick birds tend to have high bacterial loads just before they die. So those are the ones that usually transmit it quickly to other birds. And as they die, other birds start picking on them, and birds then get the bacteria themselves. Let's talk about the bacteria. The bacteria itself, as we mentioned, it's called Pasteurella multocida, or in some books, I'd say multocida. I guess it's the same organism. But it's Pasteurella. Through the years, the names have changed, but now we've agreed that it's Pasteurella multocida, and there are different subspecies, but the Pasteurella multocida subspecies multocida is the one that's mainly attributed to cause fowl cholera. It is gram-negative, non-motile, facultative anaerobe, so it can survive anaerobically or needs a little bit of CO2 to survive. Capsulated, and being capsulated itself, we'll talk about it a little bit more because it becomes important with its infection and in its control. They come pleomorphic, as you can see on the right here. They're usually bipolar rods, as you can see, but sometimes they may become pleomorphic, or they appear in chains or filamentous. And that's part of when you continue to grow these birds in artificial media, they tend to change a little bit in morphology. But usually you'll see this bipolar rods, gram-negative rods. The bacteria itself has been classified different ways. Again, we have 5 capsular types. So the capsule, again, is important. They've used the capsule to determine or to group these Pasteurellas into capsular types, and there have been A, B, C, D, and F, which was devised by Carter. And these ones, we divide the different Pasteurellas, and there are 16 somatic serotypes, or LPS, lipopolysaccharides based serotypes, and this is what are commonly used to classify which serotype of Pasteurella you have. So Hiddleston used this serotyping scheme. There's another serotyping scheme out there, but basically most of the time it's the capsular serotype and the Hiddleston scheme for LPS serotypes are used to sort of group or identify which serotype you have or which particular Pasteurella you have. And as I mentioned, the capsule, the lipopolysaccharide, fimbria, outer membrane proteins, all of these are some of the virulence factors that are important in how this bacteria infects and how the birds, the immune system of the birds react to these virulence factors and antigens and in responding and against them. So all of this may come, we'll talk about these virulence factors and different antigens also as we talk a little bit about how to control it and how the infection progresses. Now, diagnosing fowl cholera is fairly easy in the field. You get a presumptive diagnosis when you see the clinical signs. As we talked about, acute high mortality, some feverish birds, and then you'll see the livers with spotting, necrosis, lesions, and then you'll see some of the lung lesions. Local lesions in the birds as you open them up during necropsy can give you a presumptive diagnosis. But the confirmation really is using bacterial isolation. Bacterial isolation is still the one that tells you, yes, it is Pasteurella multocida. We have to rule out these other bacterial and septicemic diseases. Erysipelas, even E. coli, Salmonella, they can cause some of these liver lesions as well, and they can cause some of these hyperemia and cyanosis. So again, differential diagnosis is necessary. So you have to confirm which bacteria is actually causing the disease, or which bacteria is the primary cause of the disease. Sometimes you'll see Pasteurella mixed in with colibacillosis or Ornithobacterium. So bacterial isolation and looking at the necropsy findings and looking at other tests would help you confirm the diagnosis. For bacterial isolation, it's fairly easy to look at the affected tissues, whether it's the liver, the lung. Heart blood is a good source of Pasteurella for isolation. When the birds are septicemic, there's a high level of bacteria in the heart blood. Meninges sometimes in the in other tissues, the spleen sometimes. In chronic cases, you'll see it in the swollen hocks or in the swollen wing joints, or you might see it in the wattles, as I mentioned, the comb. That's where you'll usually see some of these chronic infections. In some cases, you may not find pure cultures out of those lesions. As I mentioned, they may be co-infected with E. coli or Ornithobacterium or other bacteria. And the bone marrow is one area where I usually try to go to isolate the primary causative organism. That's the one that usually, if you pick up Pasteurella multocida there, that confirms that you do have a septicemic case or a chronic case of Pasteurella. So bacterial isolation is confirmation. We need to rule out these other bacterial infections, and even just the acute infection, the acute nature of this disease. Actually, we need to make sure you don't have avian influenza or virulent Newcastle or even infectious laryngotracheitis. So as a veterinarian, and even in the field as a producer or a farmer, you need to look and remember at these other diseases as well. It's not just, oh, I've got cholera, but make sure you do have that differentials with you. There have been other testing that have been done, other diagnostics that have been used to confirm that it is pastoral multocida. PCR, multiplex PCR has been used and is still used to confirm that it is a pastorella. There are other molecular tests available, and most of these are used really for epidemiology. These are used to determine which particular isolate you have, which particular genotype or pathotype you have, and different ways of determining which one it is have been used. But really for diagnostics, as I mentioned, bacterial isolation, PCR have been used again to confirm the infection itself. There are serologic tests that have been used. Mainly, it's been used, serology in particular have been used as a demonstration of the immune response to vaccination. There is a commercial, or there are several commercial ELISA products out there, antibody ELISA kits. But again, because antibodies come a few weeks after infection, it's not really practical for routine diagnostics. So it's ELISA, while it's there, it's usually used as more of a vaccine response, a way to measure vaccine response, or a way to measure that you did a good job in vaccinating the flock. So again, while these molecular tests are there are uses for epidemiology and ways to classify the different bacteria. But for diagnostics, it's fairly, as I mentioned, diagnostic, the necropsy lesions and the bacterial isolation is the confirmatory test. So we know the bacteria, we know how to diagnose the bacteria, we know how it infects. Let's talk more about how then do we start working with the different antigens, different ways of preventing the infection. Immunity, or the way this bacteria induces an immune response is fairly similar to others. There's both active and passive immunity. So vaccination or infection or immune response after an infection, you'll have that active immunity develop. There is little passive immunity. They have been able to show that the antibodies can be passed on to the young chicks, but it's really not a big factor. As I mentioned, really younger birds are not susceptible to infection anyway. So it's not a big factor when it regards to prevention of fowl cholera in the birds. We've talked about capsular antigens. The capsule around the pastorella have been used, or are good antigens, and they have been used as a vaccine. They've tried it to use as a vaccine for various ways. It is important for virulence. The capsule has been shown to be important for virulence. There have been strains that did not have capsules, and they tend to be less virulent. So capsule is important for the virulence and the immune response to the birds. The biggest primary stimulator of the host immune response are the lipopolysaccharides, or the LPS. These LPS is the basis for the Huddleston serotype scheme, but these LPS, and I'll show you a picture of these LPS in a few slides, but these are the primary stimulator of the immune response. They determine the serotype, and they determine also the efficacy of bacterins. And we'll talk about that more. The LPS, the different serotypes tend to have a way of discriminating infection. I guess the immune response are specific to the LPS. So vaccines work more depending on the LPS of the field isolate that you're challenged with. Outside of the LPS in the capsule, there are also other proteins within the bacterial cell that have been used as antigens or immunogens. Outer membrane proteins, porin proteins, siderophore proteins, fimbria, and there's other proteins within the outer membrane of the bacteria that have been used to see if they can be antigens or immunogens and provide protection as a vaccine. And we'll talk a little bit about that in a few slides. So here's the gram-negative cell wall, and this is what we're talking about. So here is the outer membrane, and within the outer membrane are all these different layers, phospholipid layer, and then you've got these proteins that go up through the outer membrane, and various types of proteins. You've got porin proteins, which are specialized proteins that allow nutrients, iron, other chemicals, other electrolytes that come in, go through porin proteins. Outer membrane proteins, other types of outer membrane proteins have other functions. And then you've got, as I mentioned, the LPS, or the lipopolysaccharide. And the lipopolysaccharide is actually consists of three to four different layers. The lipid A, which is sort of the base there, and then you've got an inner core portion, which is composed of different saccharides, and then an outer core portion, and then the O polysaccharide. There's an O polysaccharide. So this LPS, depending on the differences in the saccharides or the sugar molecules in this chain, determines actually the serotype. And depending again on the serotype, this is what induces the immune response, and depending on what serotype that field isolate is, will determine how good your vaccination program works against to prevent that. So the LPS is important as an immunogen and as a way to protect against the birds. The other thing about these lipopolysaccharides, while they're important as an immunogen, these are also this is also what have been called endotoxins. These are the endotoxins that can cause some of the fever and in the immune response, the reaction that you see in some of these vaccines. So these endotoxins are important not only in the virulence of the infection itself, but also the immune response or the reaction that vaccines, that live vaccines or inactivated vaccines in particular, cause against the birds. So this will come again important in our discussion of vaccines. But all of these are good sources of antigens or immunogens that have been tried through the years as a vaccine option, aside from our live vaccines and the current bacterians that we have. Now, let's talk about prevention. Now, prevention of fowl cholera, it starts with preventing entry of the disease in the first place. Like any other disease, a good biosecurity program is important. So preventing entry of the disease, whether it's, as I mentioned, preventing entry of other animals, whether it's rodents, vermins, wild birds. So protecting that environment, making sure that no other animals can enter your barn, no other birds. Rodents is always a big issue. We often hear of outbreaks of fowl cholera when there's a big rat infestation. Um, we've heard of different big layer operations suddenly having an outbreak because the field beside it was harvested and therefore all the rats started coming into the house. We hear cases where breeder farms have started falling, getting pasturella because of rats coming in the back, or even other rodents, raccoons and other vermins come in. So preventing entry of other animals into the barn is key. One of the things, and I put cats here in particular, we've heard of, and it's historically been said that cats prevent these mice, right? You've got your rodent control by using cats. But what we've seen is also these cats actually harbor the pasturella within their mouths. And therefore, some of these cats have been found to actually keep the infection within the facility. So having cats in your layer operation or your within the farm is also, again, something that we recommend not to have. Key is good rodent control program. And a good rodent control program is not just when the birds are in the house, but you need to keep that rodent control also in between flocks. So after cleaning and disinfection, after getting the birds prep, make sure the rodents are not coming back into the house. So a good continuous rodent control program is key for prevention of fowl cholera. Keeping areas around the barns clean. We've noticed some barns tend to have a repeat of fowl cholera infection, and they've kept the barns clean. They've kept other animals away from the barns. But what we've noticed is areas around the barns where other vermins can hide or can be housed. Those are the ones that need to be removed and kept clean. The environment needs to be not just the house, but also around the house should be kept clean. Now, when you have the infection already in the house, culling birds often, as I mentioned, and picking up the dead birds quickly is a way to prevent the spread or reduce the spread. So management, animal husbandry within the house is key in preventing and controlling the disease. Again, biosecurity, sanitation, having clean environment, equipment, all of these are important for not only fowl cholera, but other diseases, but specifically downtime and cleaning and disinfection are important. And lastly, of course, vaccination. I put purposely vaccination at the bottom because without biosecurity, without sanitation and cleaning environment, without rodent control, vaccination will not really work. So you need all of these working together to really have a good prevention of fowl cholera. So vaccination, and we'll talk a little bit about the common vaccination programs, is a third or maybe one of the pillars for preventing the disease, but it's not the only pillar. You need biosecurity, you need a clean environment, you need rodent control to really have good prevention and control of fowl cholera. When you have the disease, you can treat with antimicrobials, but remember, antimicrobials will only reduce mortality. It will not prevent the birds from getting infected again or having chronic infections stay within the facility. So it reduces mortality to some point. I've seen cases of fowl cholera, well, they will treat, the mortality goes down after a few weeks, mortality comes back again, and they'll have to retreat to keep the mortality down, but it does not prevent it from spreading or prevent the infection itself. Depopulation, of course, is a one way to control, getting rid of all the flock and cleaning and disinfection and downtime. And as I mentioned, rodent control is key to preventing and controlling really the infection from spreading around. And it's not just putting traps or baits, but maybe having a professional rodent control program within your facility is necessary. Oops, sorry. So vaccines, let's talk about vaccines. Last few slides here, but to talk about vaccines, current commercial vaccines, there's basically two kinds commercially available: an inactivated or killed whole cell bacterians. Bacterians provide good humoral immunity or humoral immunity, but as I mentioned, they are limited to the closely related serotypes. So if your whole cell bacterian is a type 1, serotype 1, or a serotype 3, a serotype 4, those are the common serotypes in whole cell bacterian, they can only protect against serotype 1, 3, and 4 field challenges. That's the limitation of bacterians. If a field challenge comes from a serotype 6 or 7 or 9, which we have seen, these inactivated vaccines or bacterians will not fully protect or will not protect at all. The other disadvantage or the other limitation of a bacterian is these bacterians can cause vaccine site lesions. So when you inject them subcutaneously or inject them into the breast muscle, there is a fairly strong vaccine reaction from some of these, which causes also lesions in the breast, and sometimes actually cause the birds to back off from feeding for a few days just because of the impact of that bacterium on the birds. So they can cause some negative retardation of growth, or at least feed intake initially. Now, the other form of available commercial vaccine out there are the attenuated or the live vaccines. And right now, it's mostly PM1, as I mentioned, and M9 are the two serotypes or two types of attenuated live vaccines available. M9 is milder. PM1 is moderate virulence as far as the live vaccine. The advantage of a live vaccine is it does provide cell-mediated immunity, and it causes heterologous serotype protection. So having a live vaccine, which is usually a 3x4, will allow immune response against other serotypes, whether it's serotype 1 or a 5 or a 7. It does provide some cross protection. It also provides, they've been shown to provide local humoral immunity within the respiratory tract. The CU strain was demonstrated to have shown that. The bad thing about live vaccines, or the limitation about live vaccine, is that they are live bacteria and they can cause clinical disease themselves. They have been shown to cause up to 1 to 2% mortality after vaccination. And as I mentioned, they are a source for chronic infection, especially in breeder males. They tend to have more cases of chronic infection. So while we have two kinds of vaccines available, and for so many years, these have been the only vaccines that have been made available commercially, there are good things and bad things about them. So working them into a program or programs, you'll have to really look at what your challenge are and what your particular operation limitations may be. I went to the web and looked at the Canadian vaccines. I understand these are the current vaccines, these are the only two that I saw in Canada. I mean, I may be wrong here, but it looks like you've got one Vaxxin available, which is a type 1, 3, 4, and 3 x 4. And then you have a live M9 avirulent culture available. In the US, we have other live vaccines. We have an M9 and we have a PM1. And in other countries, you may have other also live vaccines. So I'm not sure which country you are from. If I hear there are other people registered from other countries, but you'll have to look at what available vaccines you may have. Now, we have these two types of vaccines available, and there could be a different ways of using these programs. And I've put here several ways that people have used it, and they use it for various reasons. Live programs, as I mentioned, they do provide broad spectrum immunity. So wing web vaccinations are commonly used. But the disadvantage of a live program is that protective antibodies may not last during the whole life of the flock. So especially for layer operations, a live program may not be enough. We normally see outbreaks of fowl cholera around 40, 50, 60, even 70 weeks of age, because again, by then the live vaccine program immunity has waned. To extend that immunity, people have gone through a live followed by an inactivated vaccine program. And this has been used with other bacterial diseases or other viral diseases. So it provides a broad spectrum protection provided by the live vaccine, but it also provides an extended antibody protection with the inactivated program. So that has provided some benefit also to long-lived birds. The reverse of that, when you start with an inactivated vaccine followed by the live program, have also been used. And actually this has become more popular, especially in breeder operations. And the reason for this program is that by giving an inactivated Vaxxin first as your primary or as your prime, when you put the live vaccine, which can cause some clinical disease, it actually, by priming it with an inactivated Vaxxin, actually reduces the mortality caused by the live vaccine. So people have been using this more often. So they prime with the killed and followed with the live program. And of course, you can have these programs when you have an inactivated as your first vaccination and an inactivated as your second vaccination. There's no live bacteria, so there's no clinical disease. There's no chronic disease. There's no reversion to virulence by the vaccine. So, and it does provide long-term immunity. So depending on your operation, you may have different ways of using your vaccination programs. Okay, there have been other vaccines and other vaccines. We're almost at the end here. There have been other vaccines that have been studied, developed. As I mentioned, there's the capsule, the LPS, Fimbria, other outer membrane proteins have been used as subunit vaccines, or what we call subunits. So just the pieces or the portions of those proteins are used. There have been recombinant vaccines where they've used the other bacteria to produce these proteins. So they've used recombinant vaccines using E. coli. They've done DNA vaccines. There have been studies about new adjuvants, and again, but the problem we've had through the years with these subunits and recombinants and DNA, while the technology is there and while the immunogenicity of these vaccines are good from an immunologic standpoint, there have been no real commercial vaccines that have been successful until recently. So mostly these have been created, developed, shown efficacy, but from whether it's a cost perspective or an efficacy standpoint, they have not become commercial vaccines. So maybe in the future, some of these will come forward and become commercial. We'll have to see. And depending on your country, you may be ahead of others than us here. So one vaccine that, or one of these immunogens that I'm familiar with that our company have been working on is the siderophore receptor protein. And as I mentioned, these bacterial cell wall, some of these porin proteins, which is here that are important for nutrient intake, is what we call the siderophore receptor protein. And this siderophore receptor protein, as the name implies, allows entry of iron into the cell, and iron is important for survival of the bacteria. So what we have found is that these siderophore receptor proteins are not only important or functionally important for the survival of the bacteria, but they are also good immunogens and good use for vaccines. So there is the siderophore receptor protein vaccine technology that's been developed out there. We are using it in the United States as far as for use for autogenous bacterians, but we are now starting to develop it also commercially. And I'll just share with you a couple of studies that we've done with Pasteurella or for Pasteurella using this SRP vaccine. So in this particular one, we developed a serotype 3x4 isolate. And what we do is we grow the bacteria and we actually just harvest the siderophore receptor proteins. We discard the rest of the bacteria. It's only the siderophore receptors that are used in the vaccine. And we administer it twice. In this particular case, it was administered at 22 and 25 weeks intramuscularly. And then we challenged with the serotype 1, which is the common USDA challenge. And then we look at mortality 14 days after to look at efficacy. And in this particular study, there was a inactivated bacterium as a positive control and a unvaccinated negative control. And as you can see in this study, the SRP vaccine, which is the blue bar here, prevented or had 0 mortality. The bacterium, as expected, also prevented mortality. But as you can see, the non-vaccinated birds, as expected, had mortality from the challenge. So this study was able to show that the SRP vaccine was as efficacious, at least in a serotype 1 challenge. The next challenge, however, was looking at heterologous challenge. Now, we said earlier that LPS is important for the efficacy of the vaccines. Inactivated vaccines usually are homologous, have homologous efficacy. We wanted to show heterologous efficacy. And in this case, the vaccine was taken from a serotype 2x5 and a 3x4. So 2 different isolates. Again, we grow them, we harvest the SRP, and then we vaccinate birds again at 12 weeks. This one, a younger challenge, 12 weeks and 15 weeks. Challenge at 17 with 2 different isolates, actually, 2 different challenge isolates. And then we looked at mortality. And as you can see, the vaccinated birds reduced mortality or prevented birds from the infection, from the challenge organism. Now, depending on the challenge organism, it depends also, shows also the difference in efficacy. So again, these new vaccines are there, they're being developed, but right now we have the live and inactivated vaccines. Fowl cholera, in summary, will still be there. It will continue to be an important disease in poultry and other avian species, especially as we move to the cage-free and antibiotic-free birds. Pasteurella infection will continue to be out there. And prevention and control of fowl cholera, as I mentioned, will require not only good biosecurity, farm management, and husbandry, and the use of appropriate vaccines. It has to be all three. You cannot rely on just vaccines. We need to have good farm management. We need to have good rodent control. We need to have good biosecurity. And that, I thank you very much. And